More and more radiologists are relying on the rich diagnostic possibilities offered by true dual energy imaging on Siemens CT scanner fleet ranging from Somatom Prospective up to the outstanding Somatom Force. The question is, what makes true dual energy stand out? Look for these three criteria: crisp images with the option for even sharper contrast and significant metal artifact reduction, no extra dose in both single source or dual source energy scans, and a broad applicability for virtually all clinical questions and patients. Seeing the effect of pulmonary emboli, non-invasively diagnosing gout or detecting malignant lesions by their iodine uptake leads you into a new age of therapeutic decision-making. This movie will show you how to evaluate CT dual energy datasets using syngo via. First, make sure that the study is correctly assigned to the CT dual energy workflow. If not, right-click and select Open with CT dual energy. Depending on the body region and the presence of contrast agent, syngo via will choose a specific application profile consisting of a subset of application classes that best suits the patient's procedure. You can change the default application profiles in the configuration panel. However, from VB10 you can choose on the fly any of the individual applications by just selecting it from the drop-down list. On the top of these dedicated applications, there is a subset of common dual energy tools with basic functionalities. Let's have a look at how you can get the most out of them. When you open a dual energy dataset, a mixed image is displayed as a combination of the low and high kV data. On the bottom of any of the MPR segments, a slider allows you to change the mixing ratio according to your needs. For example, move the slider towards low kV value to enhance the contrast of the image, or move it towards high kV value to reduce noise. If you want to compare both series simultaneously, open the layout gallery and select the corresponding side-by-side layout. Furthermore, two additional options are available to help you enhance the contrast to noise ratio of your data: optimum contrast and monoenergetic. The monoenergetic mode simulates images that are equivalent to images scanned with a single photon energy beam, depending on the energy KeV value. This is especially interesting if you want to enhance the conspicuity of lesions. For more comprehensive evaluation, you can set a ROI monoenergetic, which you can find in the upper right corner menu in the MPR segments. The purple bar shows the current monoenergetic level. The white curve shows the attenuation of the tissue inside the ROI at the different energies. The blue curve shows the contrast to noise ratio for the iodine, so you can use this curve as a guidance to pick the KeV level with a maximum contrast to noise ratio. Monoenergetic could also be very helpful for reducing metal artifacts. Notice how you can improve it by shifting the reconstruction to the area between the white dashed lines, recommended for prosthesis imaging. From the large portfolio of dedicated dual energy application classes in this movie, we will show you only a subset, which should be representative for the usage of all of them. Let's start with liver virtual non-contrast. The contrast media uptake of a lesion can be an indicator for its malignancy, and therefore in oncology, a series without contrast media is always recommended. However, with dual energy, it is possible to view a virtual non-contrast image to locate the tumor without the need for an additional scan. The fused image displayed shows a combination of the VNC data and the iodine uptake. You can interactively change the mixing ratio of both data or visualize both simultaneously with a side-by-side layout. If you activate the extended ROI text and create a ROI in the lesion, you will notice that liver VNC can also help you to accurately measure the iodine uptake in liver tissue and lesions. Furthermore, Information about the VNC Hounsfield unit value and the contrast media uptake in Hounsfield units are also available together with the CT value of the low and high kV and the mixed datasets. Even the concentration of fat is calculated and can be now displayed as a fat map from the layout gallery. The application class virtual unenhanced is very similar but optimized for other organs with a lower content of fat than the liver, such as the lungs, kidneys, and pancreas. The next example that we would like to show you is kidney stones. This application class supports the therapeutic decision by clarifying what type of kidney stone your patient suffers from. Kidney stones consist of uric acid and calcium oxalate, and in a few cases other material. Notice how the automatically pre-processed data shows the uric acid stones in red and any calcium compound in blue. Would you like to calculate the volume of a stone or the maximum and minimum diameter? Just activate the kidney stone marker from the upper right corner menu and click over the stone you want to evaluate. Notice that every stone is placed on the diagram for further comparison with the reference materials. In cases involving material characterization of different tissues in the body, have a look at the new row Z visualization. This application class provides an accurate material characterization based on its atomic properties. Z, the atomic number, and rho, the electronic density. When you open this application, the pre-processed data is displayed as a fusion of an atomic number image and an electronic density image. Place a ROI you need in a quantitative evaluation of both parameters. In contrast-enhanced CT scans of the vessel system, the dual energy applications, direct angio and hard plaque display play a major role. It can be difficult to differentiate between calcified plaques and iodine contrast. Most radiologists assess the grade of a stenosis visually, manually adjusting the window level. Therefore, the results can vary significantly. syngo CT Dual Energy hard plaque display provides a color overlay to help you differentiate between a remaining vessel lumen and a calcified plaque at similar CT values. If you want to remove the plaques, to simulate an angio view, open the bone removal application. There, the bone mask has been pre-processed and removed, and you can additionally show or hide the hard plaques. The latest application we will show you in this movie is bone marrow. This application allows for the segmentation and the visualization of bone marrow based on a material decomposition into bone marrow and calcium. The color map shows the density of a virtual non-calcium, that is, an image of the bone marrow without any calcium. Therefore, higher densities shown in green or yellow on this image could indicate various pathologies, such as bone bruises after trauma and diffuse tumor infiltrations. A side-by-side layout or a quantitative analysis can help you in the evaluation of such cases. If you want to save any of the calculated series for further archiving, simply click on the Archive Results icon. Saving and archiving the results series is as easy as completing the workflow by clicking the Save and Send button.